If you don't hear about us, that means we're doing a good job. We're really the masters of the operation that help it run smoothly.
Patients aren't just scans on the screen, and I wanted to make sure that I was going to be able to contribute as best as I could towards making that person be able to go back to their family.
Most of what we do in radiation oncology cannot be done without physics being involved.
The field of medical physics, we are treating some of the most challenging things you can treat within the field of radiation oncology. Our physicians want to push the field forward, and we as physicists can be that partnership.
There's a lot of interaction with us as the faculty physicists, but our residents are also involved with every other staff that is involved with patient care.
The mentors here do a very good job of guiding what interests you want to explore. They're very excited to talk about what they're doing, and they're very open.
We're trying to be not just the forefront of what is the latest and greatest, but we're actually doing a lot of things as far as new technologies, new softwares, and so there's a lot of just natural opportunity that comes from the resident perspective.
By the time the residents get to their second year, it's not really that they're just learning, they're actually working side by side and doing things under supervision of the faculty.
I find it to be extremely enjoyable to do what we do and to be as involved as we are with something extremely sophisticated.
I think what brought me to UH more so than anything else was the people. When I was interviewing, it was obvious that every single individual cared about me, not just me as an academic and me as a student, but me as a person. And I feel that coming from a large environment like New York and moving to somewhere like Cleveland, I was really able to resonate with that sense of community. And it was something that I truly wanted.
Every time I walk in, whether it's a therapist, a nurse, a doctor, everyone has a smile on their face, and it's the people that make it, awesome to come in every single day.
First thing that I ask our residents when they get here is like, what do you want to do with your life? Whether it's being here in Cleveland, whether it's, going back home. But at the end of the day, it's my job as a residency director to make sure that you are successful in how you define success.
I was excited that there is a part of physics where I can work directly in healthcare. Being in the field right now, it confirms more and more that this is the field that I want to be for the rest of my career.
You kind of see the effect of your work on a day-to-day basis. It's not like you have to do this experiment for years and years and then finally get the results. So it's very instant gratification.
I would say this residency is for anybody who has an interest in being part of a community, has an interest in growing as not only an individual, but as a future leader.
If we can find individuals who want to push the needle for radiation oncology, that helps not only just our program, but helps the field as a whole. We're here to learn what is great now, but then also learn what is coming up, and then also try to improve on it to make the standard of care better.
You're going to make lifelong connections. Some of the physicians and some of the physicists that work here are known throughout the entirety of America. You can see the tangible effect on your future, and you can see that everybody's working hard, everybody's working towards a common goal, and everybody wants what's in the best interest of the patients. As I go through my career, I'll use what I've learned at UH forever.